Dave is originally from Scotland and moved to the Netherlands on a temporary basis, he said, in 1979. But in the end, he ended up working 35 years as an anesthesiologist and intensivist in Beverwijk in the Red Cross Hospital. He has had numerous positions as a president in international boards around burn care, and we are very happy to have him to give a talk. Thank you.
Well, thank you very much. And I must say it's an honor and also a great pleasure to be participating in this meeting. So whoever it was that thought of it, I suspect Matthijs, thank you very much. And indeed, my work was as anesthesiologist and intensivist at the Red Cross Hospital in Beverwijk, one of the 3 burn centres in the Netherlands. And this was my world, looking after critically injured patients. And this was my sphere of interest. I was interested in the pathophysiology of burns. And I've kept this slide in. It just shows the movement of water across the capillary membrane. I've just kept it in to show you the level of my nerdiness. So how did I get from there to here? Well, the thing is that the patients that I was interested in, patients with extensive burn injuries, are really not very common, thankfully, in the Netherlands. So in order to keep up to date, to be educated in this young specialism, you have to remember that modern burn care is about the same age as the Beatles. So it was essential to go abroad to visit the quite young associations which were there, the European Burn Association, the American Burn Association, and the ISBI. And I've always been very grateful to the hospital, my colleagues, and the administration there, and also the Dutch Burn Foundation for supporting my journey in various different ways. So I've only got a few minutes to speak, so I'm not going to bore you with lots of anecdotes. But personally, I just seem to float upwards in that world. I enjoyed going to these congresses, mainly because it gave me a chance to speak English. But anyway, eventually I became a member of the executive of the ISBI and began to get a global perspective in burns. Because as we know, the problems are not in the Netherlands, but in sub-Saharan Africa and in the Indian subcontinent in particular. So I learned a lot about prevention, and I think that has to be the main international thrust. We have to try to prevent burns from happening as well as treating them better. But it's another story. I was really strongly influenced by a visit to this hospital in Zambia, in Katete. Our daughter had gone there as a volunteer to do a post in engineering, and we went out to visit. And yeah, I saw wounds, burn wounds, which to my eyes were really being neglected, not willfully of course, but through ignorance. This circumscript third-degree burn on the leg, the patient had been in the hospital for about 3 weeks and nothing was happening. And this child with a scald burn, his burn has deepened due to poor wound care, really. It's quite interesting. You can see around the margins of the burn where the reepithelialization has taken place, but this is after 2.5 weeks. So when I became president of the ISBI, my personal mission was clear. The dates on the program are wrong. I became president in 2010, and it's a post for 2 years. But these were the thoughts that were in my head to move the ISBI forward at this time. Defining basic standards for equipment and facilities. I don't think we have done enough on that by any means. Defining basic standards of treatment, and there has been progress in that, and promoting the development and delivery of appropriate educational programs. and ensuring durability. And if anybody wants to read more about it, there's these two Dutch guys who have been writing some very good publications, Dr. Botman and Dr. Hendricks. And one of my duties was to host the ISBI conference in Edinburgh. And when it came to thinking about a logo, it took me about a minute. And that's it, one world, one standard of burn care. And it seems to have had some traction. One of the more or less direct spin-offs was the publication of the ISBI practice guidelines for burn care. And I think they've been quite successful. And now we have this fantastic ebook, which is coming up, and will be introduced this afternoon. What can I say? I think as a senior member of the international burn community, I'd like to thank Matthijs and Tom very sincerely for their excellent work in this field and helping to alleviate the burden of burn care, particularly in those countries where the burden is the greatest. So it's your day, and you should be very, very proud of what you've achieved. And for my part, if I've done anything in my journey that's influenced you in your journey, then I'm a little bit proud as well. Thank you very much.